Discover essential practices for comprehensive bathing, grooming, and oral hygiene to ensure optimal health and well-being. This course provides essential training in assisting patients with activities of daily living ADLs, focusing on bathing, grooming, and oral hygiene. These tasks are vital to maintaining the dignity, health, and well-being of patients, especially those with limited mobility or illness. Activities of daily living, ADLs, encompass tasks like bathing, grooming, and oral hygiene, which are necessary for maintaining personal hygiene and overall health. For nursing assistants and healthcare workers, assisting with ADLs requires both technical skill and sensitivity to the patient's needs, preferences, and comfort. This course covers the proper techniques for providing these essential services while ensuring patient safety, dignity, and infection control. Introduction to Activities of Daily Living, ADLs. ADLs are essential tasks that support personal well-being. For many patients, particularly those with chronic illness, injury, or limited mobility, the ability to perform ADLs independently may be compromised. The basic ADLs include bathing, the process of cleaning the body to maintain hygiene and prevent infections. Grooming, tasks like hair care, nail trimming, and shaving to promote personal hygiene and comfort. Oral hygiene, brushing teeth, flossing, and caring for dentures to prevent oral infections and discomfort. Dressing and undressing, assisting patients with clothing based on their condition or preferences. Toileting, helping patients with bathroom needs, ensuring privacy and dignity. Mobility, supporting patients in moving around, whether from bed to chair or assisting with walking. For CNAs, assisting with ADLs requires careful attention to both patient needs and safety protocols. ADLs are not just about performing a task, they also ensure the patient's emotional well-being and dignity are preserved. Bathing techniques: bed, shower, and sponge baths. Bathing is a fundamental part of personal care. CNAs must be proficient in different methods of bathing depending on the patient's mobility, preferences, and medical condition. Types of bathing: bed bath, for patients unable to leave their bed. Gather necessary supplies: washcloths, towels, basin of warm water, soap, lotion. Ensure patient comfort and privacy. Use one section of the washcloth at a time, starting from the face and moving down to the feet. Provide assistance in washing the face, arms, chest, and legs, ensuring proper exposure and keeping the patient warm. Dry the body thoroughly to prevent moisture buildup, especially in skin folds. Shower or tub bath. For ambulatory or semi-ambulatory patients, ensure the environment is safe. Non-slip mats, towel rails. Use appropriate temperature settings to avoid burns or chills. Assist with positioning and provide balance support. Sponge bath, typically done for patients who can sit up but cannot shower. Use a sponge or washcloth, focusing on cleaning the patient without using a full bath. Clean the face, arms, back, chest, and legs while ensuring modesty and comfort. Key points to remember: always maintain patient privacy. Use gentle techniques to prevent skin irritation or injury. Be mindful of any medical devices, such as IVs, catheters, or oxygen tubes when bathing. Grooming: hair, nails, and skincare. Grooming is an essential part of maintaining self-esteem and comfort. Proper grooming also contributes to overall health by preventing conditions like skin breakdown or infection. Hair care: combing and brushing. Regular combing helps prevent tangling and promotes scalp health. Shampooing: for patients with hair, ensure that water temperature is comfortable and gently massage the scalp. Shaving: some patients require assistance with shaving. Always use the correct tools. Electric razor for those with sensitive skin, and ensure the patient is comfortable and safe. Nail care, trimming. Proper trimming prevents discomfort, injury, or infection. Filing and polishing. Be gentle when filing nails to prevent damage, especially in diabetics or those with poor circulation. Skin care, moisturizing. Applying lotion helps keep skin hydrated, especially in dry environments or with patients who are bedridden. Inspecting skin for signs of breakdown. Always check for pressure ulcers, redness, or sores, especially in immobile patients. Key points to remember. Always ask the patient about their preferences regarding grooming. Be gentle and cautious to prevent injury, especially for patients with frail or sensitive skin. Pay attention to signs of infection or changes in skin condition, and report abnormalities to nursing staff. Oral hygiene, proper brushing, flossing, and denture care. Oral hygiene is crucial for preventing infections, pain, and discomfort. Poor oral care can lead to periodontal disease, tooth loss, and even systemic infections like pneumonia. Steps for brushing teeth. Wet the toothbrush and apply a pea-sized amount of toothpaste. Brush all surfaces of the teeth, outer, inner, and chewing surfaces, using gentle, circular motions. Brush the tongue to remove bacteria. Use a soft, bristled toothbrush for sensitive mouths or patients with gum disease. Flossing. Use a piece of dental floss and gently insert it between the teeth. Use an up and down motion to clean the sides of each tooth and avoid snapping or forcing the floss. Denture care. Remove dentures and place them in a cup with warm, not hot water. Use a soft brush to clean the dentures, removing food particles and plaque. Ensure dentures are properly stored in a safe and clean place when not in use. Key points to remember. Encourage regular brushing and flossing to prevent gum disease. Be mindful of patients with limited mobility or dementia who may need extra assistance. Always wear gloves when handling a patient's oral care equipment, including dentures. Infection control and safety during ADL assistance. Infection control is critical when assisting with ADLs to prevent the spread of bacteria, viruses, and other pathogens. Key infection control principles. Hand hygiene. Wash hands thoroughly before and after assisting with ADLs. Gloves. Wear gloves when handling body fluids, cleaning wounds, or performing oral care. Personal protective equipment. Use PPE as required, particularly during procedures that involve body fluids. Disinfection. Ensure all grooming tools and bathing equipment are properly sanitized after each use. Ensuring safety. Always check that the environment is free of hazards. Example, wet floors, unstable furniture. When assisting with ADLs, maintain patient comfort and prevent falls by using proper techniques and equipment. Example, non-slip bath mats. Monitor for signs of discomfort, skin breakdown, or infection, and report any concerns. Cultural sensitivity and patient dignity in ADLs. Respecting patient dignity during ADL care is essential for building trust and providing compassionate care. Cultural sensitivity also plays a role in providing personalized and respectful services. Key considerations. Respect patient privacy. Always provide privacy by covering the patient appropriately and closing doors or curtains during care. Ask about preferences. Different cultures and individuals have varying expectations about personal care. Always inquire about preferences and follow them to the best of your ability. Maintain dignity. When assisting with intimate tasks like bathing or dressing, ensure the patient feels respected by explaining what you are doing, using appropriate language, and working within their comfort zone. Be non-judgmental. Foster an environment of respect and understanding, avoiding comments or behavior that might cause discomfort. CNA responsibilities in ADL care and documentation. As a CNA, you are not only responsible for providing physical assistance, but also for accurately documenting the assistance provided. Documentation guidelines. Record the type of care provided, including any changes in the patient's skin condition or physical state. Note if the patient had difficulty performing any ADLs or if there were signs of discomfort. Report any unusual findings. Example, sores, infections, excessive fatigue, to the nurse or healthcare provider immediately. Always ensure the accuracy and timeliness of your documentation, as it is a legal record that supports patient care and safety.